Hi Atiya, how are you? Very much audible. Walaikum assalam, walaikum assalam. So I'm visible as well. So that's great. That's great. Okay, fine. So very good. Hi Sanya, how are you? Good to see you. Hi Salma, assalamu alaikum. How are you doing? Hi Maryada, hi Neha, Spurti, Sanjana, Shaima. I can see so many familiar names. Palvisha, and who else? iPhone. Tanya. Hi, Tanya. Aisha. How are you guys doing? Amisha. That's great. That's great. That's great. Okay. So I hope you guys are preparing well. Exam just like around the corner after 2 to 3 days. I think there is going to be first face-to-face exam in UK on 10th. All right. And I think on from 12th, nice to see you, Salma. Thank you. So from 12th, I think the online exams will start as well. Yeah, isn't it? So, we have to be like, I mean, kind of, this thing. Okay, hold on. Who's this? Okay, I'm sorry. Okay, fine. Yes, sure. Okay. Thank you. So, guys, this is an open queries, and the any kind of if you guys have any query, any ambiguity in anywhere in exam, okay, with regard to any station, anything, okay, so you guys can ask me. So we are going to start now, okay. So I welcome you all on behalf of Med Exam Expert. You know me almost, okay. Almost everybody know me that I'm Dr. Zaib Qureshi. So Dr. Hassan is going to join us shortly. So before that, I really would appreciate if any one of you, could ask that, if you guys have any query, any question, any ambiguity in any station. So I'm here to answer. Okay. So because it's not going to be the kind of, the usual session in which we are going to play role player station or the structured discussion task. So anyone, all of you are invited. So it's going to be like, I mean, of course, like, I mean, how we are going to behave in exam, and how we are going to the perform the stations in our exam as well. All right. And apart from that, a few things I would like to say, that how you are going to do in the exam. This is very much important. First of all, you have to be confident. Okay. Believe in yourself that you can do it, and of course you can do it. And so far, you have studied so far, okay, and you have prepared, okay, well, so far for this exam. So all you have to do is, now it is the time when you have to utilize, whatever you have studied, whatever you have practiced. All right. And this is the high time when you shouldn't be touching any new thing. Okay, let me just tell you, if you haven't done anything so far, and you think that you have to do it, so I will advise you, and that's going to be my very sincere advice, that don't touch anything. Okay, don't touch any new thing in the last 3 4 days, because this is the high time when you just have to focus on yourself, and when you just have to revise your own stuff, and when you just have to do whatever you have to do. Do we have to talk about prognosis in cancer station numbers? See, it's not about prognosis, of course. But generally speaking, in exam, either they can give you, how to break the bad news for the cancer, and in last 5 years, there has been only one or two station in which they were asking about the treatment option as well, that how you are going to treat. Okay, so this way or that way, this is not going to be tough. So if it is like, I mean, the stage one, so of course, apart from the ovarian cancer, the stage one prognosis is good. Okay, for the rest of the cancers. Then comes, you can't, no, you don't have to talk in numbers, because you can't remember stage one prognosis, stage two prognosis, 1 year survival, 5 year survival, 10 year survival. That is for part two, and that's not for part three. Okay. So don't be upset about that, because if you have to talk about numbers, so probably that's going to be for a very the important things. Okay, for example, VBAC is important, twins important, the home birth is important. Then comes the in gynecology, of course, the sometimes fibroid is important. So it's important that always remember, easy thing is going to be easy for everyone. The difference what in this the difference what any candidate can make in this exam is that how beautifully you tackle any the situation what a candidate cannot deal with. Okay, so that is going to make some kind of difference in the result. That's going to make some kind of difference in the the score as well. So don't worry about it. Walaikum assalam, Tanya, good to see you. Walaikum assalam, hope you're doing good now, sleeping less. I hope so. Yeah. So, see, these days, cervical cancer in young patients with parametrial involvement. Can you give idea about that, please? So, what do you think is parametrium involvement? When does parametrium involves? Okay. Now, this is your job that you have to understand at least the basic, the stuff of that when parametrium is going to be involved, which stage is that going to be it the young age or the old age, treatment is going to remain same. Okay, treatment is going to remain same. So what do and plus the stage 2B, and if at all you have to go for that, so how do you treat it? So this is now the theory that how you are going to study and how you are going to fertility concern. So you tell me that what is the treatment of stage 2B and in which year it has come. Chemo radiation, if it is, so of course first you have to do the fertility preservation. Okay, first you have to do the fertility preservation. You have to put her in touch with the fertility specialist, because then you have to preserve the ovary. Okay, you have to preserve the ova. All right, and then afterwards you can go for chemo radiation, because after chemo radiation there is not going to be chances of fertility, isn't it? So you have to be careful when you are going to talk about the options in this woman, especially because later on there can be chances if there are no the after effects there. She's in good health, so afterwards she can go and plan for IVF, and if not, then surrogacy is an option, then adoption is an option. So this is how you talk. Okay, Aisha, Claire?
Dr. Zaib, excuse me. Assalamu alaikum.
Walaikum assalam. Walaikum assalam.
Can I ask one question, please?
2 questions. You can ask 2 questions.
So the LETS procedure, that patient is coming for the LETS procedure and she had unprotected sex last night. Yeah. So these things, everybody opinion is different. So some they told that, yes, we can postpone the LETS procedure and then we can do that coil later on. If she's after 14 days, that means her period is 15 days before. So coil is only one option. Yeah. So at that case, one option is to postpone the this LETS procedure and to coil to be inserted. Next is, I don't know that which one is correct. So the second one is that to insert the LETS procedure first, to do the LETS procedure, and then to insert the coil, but there is an increased risk of infection. Third is that to insert the coil first, and then the LETS procedure to do, but there is a risk of burn of the coil, the thread. So at the time, you have to explain to the patient that you may that you cannot find out the thread. At the time, may need to remove with the keyhole surgery. So do you think that we have to mention these 3 options or only these last 2 options?
See, my few words on this thing, because recalls are quite incomplete. So basically, usually I don't comment on them, because when candidate is inside the exam cubicle hall, the exam hall, so the station is different. when it comes to to us after exam, so it is extremely different. So when you talk to the people who were in exam, so they tell different stories. When we see the one line recall question, the story is completely different. Okay, so always the manage according to the the how role player is behaving in the exam, and what exactly is the exam scenario. Okay, so you have to talk about that. So generally speaking, if at all she is booked for the LETs, and we cannot postpone the LETs procedure, so yes, we can go for this the coil, and then we can insert coil, and the next day we can do the LETs procedure. But again, we are going to tell all pros and cons of that what can happen at that time, that there can be the burning of the thread. So we have to be very careful. Plus there is going to be the chances of bleeding, there is going to be chances of infection later on as well. So this way or that way, we have to balance both things, because we have to fix the coil, we have to go and talk about the LETs procedure as well. Okay.
Yeah, no, this is the different session, they talk differently, so that's why your
That's
opinion I want to know, that what is
Yes,
your opinion.
this is going to be my opinion.
Right, okay.
Okay.
Okay, thank
We
you very
can't
much.
postpone LETs, as far as I know, because LETs we offer to whom? Of course, we offer to high grade people, the high grade, the when there is pathology, of course.
Yeah,
Okay. So I'm not in the favor of that. We are going to just postpone the LETs because we have to fit in the coil. So I think we have to balance both things, and then we can only offer. Then of course the the decision is going to be of patients, that how she is going to take that, and how she is going to be agreed on that procedure, isn't it? So we
yeah,
have to be very open and honest, and we have to tell about these things. So I'm of this favor. So if at all the question comes like this, so if
yeah,
I am the candidate, so I'm going to perform like this.
right. And it is CN 3 and 4, CN 2 and 3.
Exactly.
Yeah,
Exactly.
yeah,
Exactly.
yeah.
Exactly.
Thank you very much. Thank you.
Welcome. Welcome. Second question,
I'm agree
Salma.
with you also. I'm agree with you. This,
Thank you
thank
so
you.
much. I'm
Thank you.
happy. I'm happy. Yes, Aisha. Yeah, yeah, yeah. I'm in the same opinion. Yeah, that's great. Okay. So few tips, before you go to exam. So first thing I have told you guys is that, be yourself. Don't imitate. Be natural. Okay. You don't have to fake anything. Okay. Whatever you are, okay, you are okay with that, and you have to be okay with that as well. All right. So secondly, when you enter in the exam, so stay confident, stay calm. This is just exam, this is not a matter of life and death. Okay, so don't take it on your nerves to that way that it's going to affect your mental health and physical health as well. Okay, this is going to be my the sincere advice to all of you. So in these 3 to 4 days, just stay calm, revise your own stuff, revise your own stations, don't touch new things, don't go here and there and sneak here and there, that what is happening in that group, what is happening in that group. So this way you are going to be scattered. Okay, so you have to stay focused, you have to bring your thought process to one point where you are just going to focus on yourself. Okay, I know this is very tempting, being a the student, we all are the kind of keen learner, and we really want to see that what that candidate is doing, what that group is doing, what is happening in that. But the problem is we don't have that much time to waste at this the the hour. So we all need to be so focused. Okay, so whatever you have studied so far, just stay confident in that, just revise your own stuff. If you guys are with any mentor, so ask your queries to that mentor. If you think he or she is not capable, then of course you can go to other one. But this is going to be my suggestion, that stay focused. Because these 4 or 5 days, or even if you guys have, because many people have exam on 17th, isn't it? So of course you guys have almost 10 days. So in 10 days you have to be focused, as much as focused as possible. Trust me, the last days, until and unless you revise, it's not going to help you. Whatever you have studied so far in the the previous months, and the previous courses or whatever. Okay, so if you are not going to revise, it's not going to help, because you have to revise your own stuff. Okay, and plus, don't memorize lines. Okay, if I am speaking, so that is me, how I can speak. So you can just take the few words from me, from her, from him, from anywhere there is, but you have to make your own combination. Okay, so it really looks sometimes the strange, when every other candidate is coming, and we are listing the same phrases, same thing from everybody there is. Okay, so be yourself. This again I will repeat, be yourself. Whatever you have studied so far, be confident in that. All right. And secondly, before exam, like I said, that don't practice new stations, plus don't run after questions. Okay, that what has come on 10th. Okay, so this way you're losing your 2 hours, 3 hours just scanning the groups and just asking here and there that what is happening around. Okay, just stay focused, whatever will come, so you are capable enough to solve. So it shouldn't be like, I mean, that something new will come. All right, so far you had the 4 very beautiful practice books, so I'm sure all of you have done them. So you have scanned the past papers as well. So you can say that if you have scanned almost 100 plus stations, so I don't think exam is going to be out of that. The difference, what exactly it is going to make, is that how you are going to present yourself. All right, because non-verbal communication is as much as important as verbal communication. Remember, you don't have to be robots. Okay, you are dealing with humans, so you have to be human to deal with humans as well. All right, so don't need to be so stiff, like, I mean, something is going to happen, don't need to be like, I mean, shy, that no, I don't have to ask any question. And plus, no need to kind of the what you can say, that like, I mean, signpost for everything. Pardon me asking this, I'm sorry I have to ask you this, I'm sorry, this is part of. Why are you sorry? Have you done something wrong to somebody? Okay, until unless you really think that it is like, I mean, kind of a very intrusive question in which you have to say something, and you can say that I'm sorry, I have to or you can say that I have to ask a couple of the questions which are a bit sensitive, and but it's going to help me in managing you and your case. All right, so I think this is a better way, rather than I'm sorry, I have to ask you a question, I'm sorry, I will call my nurse, she will take your blood pressure, she will take your pulse, and I will do your tummy. And please don't move your hands like this. We are not kids anymore, right? Nobody is a kid in this business, MRCOG. All right, we all are grown up doctors, so you have to behave like this. So don't say that my nurse will come, she will take your blood pressure, she will take your pulse, and don't move like this, your hands, or your movements, it shouldn't be like this. Okay, stay confident that we have to do some observations, we have to check your blood pressure, we have to check your pulse, and then I have to examine you in the presence of chaperone. And yes, examination again, when we were in face-to-face exams, so even examination was not necessary at that time. So how come everybody is doing online the chaperone examination? Okay, so no, it doesn't make any sense until and unless you think that yes, in this station I do need to examine, and I do have to run some investigations because it's going to help me in my management. So in that case you can say, because in that case you may get the examination findings. And this happens. Okay, and this happens, basically it happens in early pregnancy case viva, early pregnancy module, the vivas. Basically it happens in somewhat the cases of infertility as well, in which you need some investigations, because only then you are going to manage your cases. Okay, so I think it is very unwise to tell everybody that I have to run investigation, because it takes time. According to my opinion, in this exam, all you have to do is that you have to do all effort to save your time, because that time can be utilized in the management part. And later on you have to complete the loop by asking the woman that do you have any question, do you have any was there anything I was not clear about, do you want to ask anything, do you want me to repeat anything? This way it will look more beautiful, rather than going here and there and just talking about that. I mean, I may need to examine you in the presence of chaperone, then my nurse will come and take your blood pressure, pulse, and temperature, then I will do your tummy examination, how baby is lying in the womb, then I may need to do speculum examination and for vaginal examination as well. It is taking 2 minutes time, isn't it? So we have to be very careful and very choosy while you have to do the examination. If we have pronounced patient name repeatedly, what is nothing? It doesn't make any difference. Okay, it doesn't make any difference, as long as you are gentle, as long as you are kind of the saying that Julie, I know, I mean, this news has come to you as a shock, Julie. So I mean, Do you need any kind of help at the moment? Would you like to be my nurse to sit with you to give you some support at the moment, Julie? So that's okay. Julie is not going to mind. Wrong name. Ah, that is. I mean, one time is okay, but of course not like every time. So if you have realized during the session that okay, you are pronouncing the wrong name, so at the same time you can stop yourself and you can say, oh, I'm sorry. Can I just cross check your name again, please? So it's not going to make any difference. So come back again rather than doing the same mistake over and over. Okay, Sunanda? All right. So, I mean, nothing is as, the kind of specific or stick, the stiff in terms of, that you cannot come back. 10 minutes are yours. You can utilize those 10 minutes very effectively if you really want to. So it is all in your hands, like, how you are going to utilize. All right. Um, it's up to you, sweetheart Aisha. So I mean, I don't know. Me myself, I have never done. I have been through this exam twice. Once I have failed, once I have passed. Now I'm examiner as well. So I don't know. I don't. Maybe I'm misfit in some of the criterias, but that's how I take. The things should be easy. Things should be easy. Okay, things should be the easy going because we are dealing with humans. My idea of the saying is that even if it is online consultation, even if it is a video consultation, we are dealing with humans, isn't it? We are dealing with humans, so we have to be human as well. All right, so we don't have to be a robot at all time. It's all up to you, whatever you are comfortable with. If you think that you can do and you can save your time, and if you have rehearsed this way, so I'm not going to ask you that please don't say. But if you are comfortable, if you have rehearsed this way, so it's all up to you. Me myself, I have never done examination in face-to-face examination. So far I don't teach this to my students as well, so I hope many of the people will agree with me or disagree with me. This is just the kind of matter of how you train yourself, and how you have got the training. So this is like both ways. For me, I have never done it. I'll be very honest with you. Okay, so I have never examined anybody until unless I had a clue that yes, I do need examination because that's going to help me in my management. For example, it was a case of OHSS. It was a case of the nausea, vomiting, and pregnancy. It was a case of fertility, that yes, I do need some examination findings. Yes, I do need semen analysis to go ahead with my management, isn't it? So in that case, I do need. But unnecessarily, I'm not going to ask anyone to go lie down. I will do examination. I will call one chaperone. Then I will waste my 2 minutes time, and then later on, when I'll start my management, the bell will ring. Okay, all you have to do is in 10 minutes time you have to prove yourself as a good, safe, practicing doctor, as well as you have to show your applied clinical knowledge as well. All right, this is not the matter of only the communication skills, isn't it? We have got the 5 domains, so you have to at least pass whatever the domain has the good weightage in that station, be it applied clinical knowledge or whatever. Again, I will repeat the same, that you have to be like, I mean, kind of not like 100% stiff in your consultation. All you have to do is the consultation should be the kind of smooth. Pre-pregnancy counseling is antenatal, postpartum, and the intrapartum. Okay, you have to take the woman to this pregnancy up till the next pregnancy. You have to give her contraception as well in the end. So it should be very crisp. It should be very you have to give information in small chunks. It's not like that you are going to deal in complete detail and in depth. Okay, Atia? Pre-pregnancy is always the pre-pregnancy, antepartum, intrapartum, and postpartum. Okay, yeah. And again, you can simply ask when you are going to start your consultation. Okay, so you can simply ask just to narrow down your options, that where you are going to emphasize and what you are going to speak. You are going to ask that, do you have any specific concern with today's consultation, or would you like me to talk about something specific in detail? Or if you think that she doesn't have anything, so you can simply say that Are you the person who is interested in learning almost everything about, anything, like for example about this disease, for example the diabetes? Okay, so this way, you can narrow down your, the own things that, where you are going to emphasize for your consultation. Okay, so don't forget to ask about concerns, because sometimes what happens is that, if we don't have any clue about any station, so sometimes, that if she has any particular concern, so this way, we can, come back in that station that, okay, yes, I will be emphasizing on this thing, because she is just interested in asking that thing. All right. Any other question? Atya, is it clear? Oh, okay. Agenda. Yeah, agenda setting is good, but don't take it, up to like, one paragraph, two paragraph. Okay. So, it should be very crisp. And yes, one thing, important thing. Um, for the question, if it is given on the, outside the cubicle, if you have a question, okay, and almost half of the details are there, okay. So don't rephrase or paraphrase that question, okay. Just pick the positive point and then, just go ahead. Just pick the positive point and then go ahead, okay. So, this is how you can do it only. Labor ward cases, go room to room. Go room to room, okay. Go room by room, and if you think that one room is empty and any case is coming and that is emergency, so you can say that once I will be dealing with all these cases, and if this patient arrives, for example, that is quad prolapse, for example, that is any kind of fetal distress or something, so you will say that I will ask the midwife to just inform me while I'll be managing those cases, so I will quickly come back to that patient. Okay, so go room by room and then prioritize, and likewise in the theater list as well. Okay, go room by room, because this way you don't want to miss anything. And plus, if people go from room number 1 to room number 10, then room number 6, then room number 7, you will be lost. You will be lost yourself. Okay, so this is a matter of nerves, of course, so you have to be composed in exam. So don't be upset if you think that you don't know anything about this station. So just start your station, ask introduction, set agenda, then ask concerns. So she might give you some kind of hints that, okay, I am interested in learning this thing and I want to know about this thing. Okay, so this way even you can carry on your consultation. And apart from that, in terms of the these 3 to 4 days, because many people were texting me that how we are going to utilize. Mm, no need to, like I was telling you guys, that you don't need to rephrase or paraphrase those lines again. Okay, if something is given, so yes, it is given, take it as such. Why you have to again, until unless you think that the information given and you need to cross check. Okay, so you have to cross check in a way that it should be like, very good. Oh my god, azoospermia. If I'm azoospermic, I won't let anybody know that I'm azoospermic. Come on, that is very sensitive. No need to ask, no need to ask. Do you think that anybody will like who is having azoospermia, or if anybody is having tubal block? Hmm? Yes or no? All of you, your opinion. All of you. Atya, would you like somebody know that somebody is having azoospermia? Neha, Maryada, Nai, Sunanda, what do you think? Hmm? Thank you. Thank you. This is so sensitive. This is so personal. All right. So please be extremely careful. I'm having azoospermia, and you are asking me that can I call somebody in to support you, that because you are having azoospermia. AIS and Turner syndrome. See, Turner syndrome most of the time is a known case, and AIS can be the tricky case, because this is very dangerous. Okay, so in AIS and Turner syndrome usually there is a case in which a woman is coming for her fertility wishes. Okay, so of course in that case that looks very the kind of straightforward case. It doesn't it don't have any kind of the things, but AIS is very tricky. So in AIS, yes, you can you can call, especially the counselor nurse. Okay, you can call your nurse to sit with her, and give her, you know, the support. Okay. But until unless, you know, you can ask that, you know, because I'm going to, you know, talk about so many things in today's consultation. So would you like somebody to be with you from your friends or family, or shall I call my nurse to sit with you and, you know, to give you some kind of support? You know, this way you can, give her some kind of signpost, because, you know, all these are things are very sensitive, and perhaps, you know, people don't want, you know, someone else from the family and you know, the friends especially, to know about them. So you have to be very gentle and sensitive while you are going to ask about them. Okay. AIS is very important station, all of you. Okay. So go through all these things, because AIS, Turner syndrome, MRCOG syndrome, and you know, all these, yeah, transgender, these topics are, you know, frequently coming in exam these days. So, you know, you have to be very quick in picking up the station, plus, you know, the dealing with them very sensitively and all. So this is very much important. Yeah, see, DIP. So I'm sorry, I can't read your name. But you know, in infertility, if the wife's reports are, you know, the completely normal, so you can simply, you know, ask that. Usually in infertility settings, you know, the couples are there to see you, right? So if couples are there, so, you know, naturally they will be aware of that, you know, they are going through investigations, they are going through, you know, everything together. So, you know, in that case, you can simply, you know, ask that, you know, does your, you know, the husband knows that you are here to collect the reports? Okay. If either of the partners report is normal, so I don't think that there is harm in telling, in my opinion, because, you know, until and unless there is, you know, a lot of, you know, the kind of problem. For example, husband is not here, only wife is here, and in husband reports there is, you know, the gross, teratosteno, zoospermia. So in that case, yes, you know, that can be a little bit sensitive. Okay, but if the reports are absolutely normal, and you know, the either of the partner is here, so you can simply ask that, you know, does your wife know that you are here to discuss about reports? Does your husband know that you are here to discuss about reports? Okay, so this way, you know, you can check if they are normal. So I think you can tell. There is, you know, the nothing to hide about. Congenital abnormalities which are not BBN, yeah. So if it is isolated choroid plexus cyst, if it is isolated, you know, what is that, talipes equinovarus, if it is that isolated, plus, this is not BBN according to me, at the moment, what I can, you know, remember. But, you know, the, yeah, isolated choroid plexus cyst. So if it is, you know, if it is isolated, then it's not BBN, because choroid plexus cyst will resolve by 26 weeks, as far as I remember. And you know, the this club foot, or, you know, the telepiece, it's not even bad. Yeah, yeah, of course you can talk. Okay, if reports are normal, so then there is no, you know, there is nothing that you are unnecessarily be, you know, telling again and again that I'm sorry, this is matter of confidentiality, I'm sorry, I cannot do that. So I think, you know, avoid, you know, such kind of phrases. Isolated cystic hygroma. mm, Cystic hygroma, I think it is plus minus, because, you know, most of the time it is associated with congenital, you know, the malformations. So cystic hygroma, according to me, it's not normal. Okay, but still, you know, you can check. But you know, that these two things which frequently come in exam is choroid plexus cyst, and the other is the club foot. Okay, so be extremely careful while you are going to counsel. Give, you know, the warning shots, and don't be so blunt when you are giving, you know, the any kind of news or any kind of diagnosis. Okay. uh, so it's your job. Okay, it's your job, that if somebody is asking you what is your immediate management, so immediate management should be immediate. It's not like that you will start from today and you will take the woman to her home later on. Okay, immediate is immediate. So this is, you know, a candidate job to understand the question first and then answer. Okay, labor ward scenario, nobody is going to tell you anything. This is your job until unless you think that you need additional information. So yes, you are going to ask. For example, the woman is laboring, so you need Bishop score. because then only you can manage, isn't it? So if woman is in labor since morning and, and now you are about to take the, the charge of the labor ward, so in that case you are going to ask that, are there any labor, are there any the findings, vaginal findings available? Because I need to know that, how far is she in her labor at the moment? How about her baby? So like this, you can ask. So laboring woman, so yes, you need further information. If you won't ask, nobody is going to give. Okay. If you won't ask anything, so nobody is going to help you. All right. Structured discussions are very important as well as tricky in the sense that, of course, first of all, you have to understand. What happens is that, I'm asking one question and candidate is taking me through the complete guideline. Okay, always remember that in structured discussion, until and unless examiner is asking you that, okay, there is, the one question, what is that? The Crohn's disease, okay? Yeah, inflammatory, okay? So in that case, of course, he asked only one question because it was my exam question as well. So he asked only one question that, could you please summarize the case and take me through the management plan? That's it. Okay. So if until unless that's the case, so you are going to do. Otherwise, usually in a structured discussion there are going to be more than 3 questions. In labor ward, we say more details or have to specifically ask. You have to say, if you are going to ask that, can I have the CTG finding if there is any, or are there any the PV findings? So you have to ask. Nobody is going to assume that you want this. This is your job. You have to understand that, okay, I need CTG, I need PV findings at the moment because now only I can manage the case. Okay. So try, the doing this, because you will be given, the some of the information on in front of you. But of course, you have to ask some of the information because then only you have to deal. Okay. Okay. Any other question? Or shall I go ahead? What I want to talk? Hala, how are you? Good to see you.
I can't participate.
Okay, okay, fine. No problem. Good to see
The
you.
car.
Okay, fine. Good to see you anyway. Okay, that's great. That's great. He's our very dear student and very dear colleague as well. Isolated echogenic bowel. Yeah, echogenic bowel as well. Yes. Okay, that's great. So where was I? Oh yeah. So I was at question. Okay. So if so many things are given in the question, don't try to rephrase or paraphrase that question. Okay. So how you start with it, that okay, I understand that Emma and my candidate, she has given the name Emma Watson. So let's talk about this. That, hello Emma Watson. That I understand that you are 26 years and today you are here to talk and discuss about the that epilepsy and how you are going to be pregnant. And I can understand that you are on the anti-epileptic drugs, you are taking valproic acid and you are taking the why need to ask so many things? Why need to tell her? She is on. What you have to do is you have to pick that she is a known case of epilepsy and today she is here to discuss about her pre-pregnancy care, or you can say that she is pregnant and she is here to discuss about her pregnancy care. That's it. So you are going to simply start like this. Hello, hello, is this Emma Watson? Yes. So how would you like to be addressed? Yeah, Emma is fine. Okay, Emma. So I'm Dr. Qureshi, one of the doctor in the antenatal clinic here today. So I understand that you are having epilepsy and you want to discuss about your pregnancy and the pregnancy journey. Am I right? Yes, absolutely. So Emma, because this is our first, the meeting. So what I'll be doing in this consult is that I'm going to ask a couple of questions, and then I'll be reviewing your case notes with your permission, and then I'll be managing your case in the lines of and then I'll be giving you some helpful leaflets by the end of this the consultation as well. Would that be okay with you? Yes, doctor, that's okay. Okay, fine. So then you are quickly take your history, that how for how long you have this problem, and what medications are you on, and are you with your the consultation the consultant the care when was your last opinion, when was your last fit. This way you are going to get the idea that she's a low risk case or she's a high risk case. Okay, because we know that the patient needs to be fit free for 2 years to be considered as low risk, isn't it? So when you are going to counsel for her pregnancy care, so of course you are going to keep this thing in your mind. Okay, so don't completely rephrase or paraphrase the letter, or if there is any the examination finding, you can always cross check. For example, she has had fit 6 months ago, and when you are coming to your the pregnancy the management, so at that time you can cross check that. So Emma, I understand that you had last fit 6 months ago, am I right? Okay, so no need to tell in the beginning, rather you can bring the small chunk of knowledge while you are going to manage. Okay, so I think this is a good idea that if we will do, but remember my words that no need to rephrase or paraphrase the questions. Okay, all you have to do is that you have to start your station quickly, and then you have to come to the the agenda, then you have to come to the the consultation as well. Okay, so is it 2 years or 1 year? You can check. Okay, I'm an old soul now, maybe I'm missing something. Okay, so as far as I remember, that's 2 years. You can check. All right, so the 2 years of medications or 1 year the or fit, I think this is something like that. So I don't want to misguide, so you can check. All right, apart from that, in terms of like I said that your start should be very quick for the exam. You have to be very if it is a sensitive kind of station, if you think that you have to speak a lot, if you think you have to counsel a lot, then keep your all these agenda and the history taking short, because focus on your task as well. Your task is that you have to break the news, then you have to take her through the management plan. So of course breaking the news takes time, then management takes time as well. All right, so be extremely careful and quickly scan the question. Okay, quickly scan the question, because that's the only way by which you can get what exactly the question is. Don't be like kind of writing things. Okay, until and unless because it takes few seconds to switch from one station to other station. Okay, so don't unnecessarily, if you are in face-to-face exam, don't unnecessarily write things. If you really think that sometimes what happens is, when I was in my face-to-face exam, and like Sunanda has asked that we tend to forget names. So what I used to do was that if this is a notepad for me, so I used to write the name of the patient, that's it, and the complaint. For example, her name is Christy Davis, so I will write the big letters Christy Davis, and her age is 38 years. So it will be in front of me while I will start my the consultation. That's it. If you think that you can't remember names, otherwise the question will be in front of you at all times, you can always look at it. Okay, you can always look at it, so there is no harm in that, even in face to face, even in online exam. Okay, so don't make things difficult for yourself. Exam is itself exam is difficult, but not the process. Okay, because this is exam, and all of our life we all have been into so many exams. So don't be upset and don't be afraid, and just stay confident, focused, and revise your own stuff. And if you guys have made your own notes, so just listen to them, follow advices, and that's it. Okay, again I will say, read question carefully again and again. Okay, because of course you have to think of what are the domains which are being tested. uh, thank you. Thank you, Salma. So if I will send her out the room, so she has separation anxiety. She will bang the door, she will all the time come inside. So that's why she's all the time with me. So anyway, so this is how we do. Okay, so what I was telling, that question needs to be read again and again. All right, so don't be upset that if you they can't the write anything. Writing of the question is not a big thing. Rather, you just have to think of that, what are the domains which are being tested in this. Okay, so if information gathering is not there, your life is so easy, because information gathering takes time. Okay, again, in information gathering, let me tell you, me and Dr. Hassan, we have been talking about it lately too, that, this is a 70 years old woman and she is having, some problem with the waterworks, and she is here today. And plus, she has, any kind of prolapse as well. And me as a candidate, I'm worried about, pardon me asking, any recreational drugs. 70-year-old problem with the, the waterwork or the bowel work or something. And I am worried as a candidate that, pardon me, ask about, are you on any kind of drugs? Okay, so, I think, we have to refrain ourselves from asking, these type of questions which are unnecessarily, the kind of unimportant in that station per se. Okay, so, that's up to you. If you think in your management, okay, you need, oh yeah. So, I mean, she is 70 years, she is here with OAB, she is here with stress incontinence along with prolapse, and I'm worried about, pardon me asking about, I mean, are you on any recreational drugs or no? Okay, so, this really makes, no sense. And for example, this is a miscarriage case, and I'm worried about, do you have any family history of concern like diabetes, like hypertension, like clots in legs or lungs? In miscarriage, really? In miscarriage, she's worried about her own, the ultrasound report. Please, for God's sake, talk to her. Okay, talk to her regarding her scan report, talk to her regarding her management, and not the family history of clots in legs and lungs. It's not going to help me, anyway, in miscarriage management, isn't it? So I think this way you can cut down your history if you just, narrow down your, the questions, and the questions should be very specific with regard to the, the station. Okay, so again and again, I repeat this thing because this is very important according to me as exam candidate, and the as a, the teacher as well, because this thing really, helps in exam. Because once you are going to be, focused and narrowed in your history, so this way you can utilize that time in your management, because management, is important as well. And even, yes, one thing more. For example, you have forgotten taking, the history of allergy in the start, in the history. Okay, but when you will come to the management point, so when you have to, write down any kind of medications for her, so at that time you can, ask, oh, I'm sorry, I forgot to ask you, I mean, are you allergic to any medication or any substance or something? No. Okay, fine. Okay, so this way you can, always, come up with your question. If you have missed blood transfusion or the blood group, and if you think in ops cases blood group is very important, because, then we have to decide for NTD, and, in the pregnancy maybe RAADP or maybe postpartum prophylaxis as well. So yes, in that case, you can quickly, come back and you can ask, I'm sorry, I forgot to ask about, I mean, do you know what your blood group is? Yes, it's O positive. Okay, fine. Okay, and do try to, do what you can say, that, humming. Okay, sometimes you can be, I see. All right. Okay, if it is a good thing, okay, yeah, that's great. Doctor, I was smoking, but I stopped it, like, I mean, 2 years ago. Okay, that's great. It was very good of you. It was very good of you to stop it, because generally smoking is not, the good for health. And so you have to do that. Okay, so be humans in the exam, be human. Okay, so once you will narrow down your questions and options, your station is going to be so smooth, your station is going to be so beautiful. And it's not a good idea that you have to, bring your, the 2 pages template and then only you can take history. Okay, yes, is there any question? Instrument identification station. So far I have never seen. No. Cystoscopy, hysteroscopy, laparoscopy, no. Parts, no, never. It's part of our local exams, but not the. So far I haven't seen in 5 years. Okay, don't worry about it. Yeah. No. So far I haven't seen.
Madam, can I ask you a question about the connectivity? Like, when we got the testing for that connectivity and all that, no? It is coming, everything, audio, video, photo, all that is correct, but, unstable quality or something. But when I got the IT people, it's coming full, speed test is full. I don't know. I have written to the college.
Doesn't
for
matter.
it.
Doesn't matter. If you think that your connection is full speed, and if the camera can recognize your face and everything was okay by the end, so it's okay. It's not going to make any difference. Okay, but ideally you have to have the 1 or 2 net connection. Okay, 1 or 2 net connection. It's better that you have to have, because like me, I work online, so I have 3 connections at home at all times, and the 2 extra batteries for my system as well. Yeah, of course, and for exam, because this is very the important exam, so I think you have to have 2 internet connections, and the extra source of, for like, I mean, countries like us where there is the electricity issues and everything, so they have to have some backup as well. Okay, mental health issues need to ask, I think yes, because these days they are very much focusing on mental health, and even this way or that way mental health issues are at race, so at least we have to ask because it is important. Okay, Salma. Okay. Okay, so any other question, or shall I go ahead? Hmm. Okay. Okay, fine. If there is any question, you guys can ask, okay, anytime, no problem. So we were going through, the questions again. So again, it's the same thing that, think of, first of all, what domains are being tested. Okay, if information gathering is not there, your life is easy. So don't unnecessarily go into the details again, because until and unless you think that in management you need some kind of, the history points. For example, if it is a case of surgical, the case, yes, you need past surgical history, allergy history, then you need to know about the past medical history as well, because if at all she is having any kind of home ops, so yes, that you have to know when you are going to manage the case. Okay, and then read the question carefully. So I have told you guys that you have to read the question carefully, and then later you have to be very specific. Read the task. So in next 10 minutes you are going to break the news, and then you are going to take her through the management plan for this. So remember that in that 10 minutes your task is this, by keeping in mind that you have to fulfill the agenda. My experience as an online examiner point of view and advice for overseas candidate, again, I always see, I myself an overseas candidate, and I'm proud of it. Okay, because being an overseas candidate, we all do a lot of hard work. All right, so we do study, we do the work hard to match the requirement and to match the expectation for this exam. So again, I will say the same: be natural, be yourself. Okay, so I hope you guys won't mind if I will say that don't fake your accents. Okay, be yourself, whatever you are. Your English should be very clear. You should not be Britisher. You should not be a European. I am Pakistani and I will remain Pakistani until unless I'm in somewhere where I am speaking the language where I am where I have to speak. Okay, until unless but again the fake accent is going to be fake. Okay, so don't fake accents. Just be yourself. This is not a English language exam. Okay, so your communications should be like very smooth. You should be speaking in a way that the role player can understand. You can convey your the message. You can convey what you want to say. So that's it. This is all they need. They don't need the so many the people who are just coming with this and the thought process that they are going to be somebody. Okay, be yourself. All right, and be proud of yourself as well, whoever are you. So this is not going to change you, this is not going to change the circumstances, this is not going to change anything. This exam is important for you, and it has to be important for you only, not for everybody there is. You don't have to satisfy anyone. You just have to satisfy you, yourself, and your examiners, of course. Okay. So again, I will repeat the same. So be yourself. That's it. Okay. So, and plus, don't compare yourself with anybody. Don't compare your journey with anybody. Okay. Everybody has a different path. Everybody has a different, the life, and we can't fit in anyone's shoes. Okay. So more or less, we all are going through the same stress because the job, house, and everything, so many things, so we can't compare ourselves with anyone. Okay. So of course, sometimes it hurts, and sometimes, we do feel low. That is normal. We are human beings. I will again say the same. Once we will stop feeling for ourselves that, we are human beings, so of course we are not going to perform well in exam as well. All right. Yeah. COVID questions. COVID questions you can expect, but what is the management of COVID? Hmm? What is the management of COVID? That you need to know. Okay. The basic stuff. Okay. The basic stuff you have to know. Okay. If it is a, the kind of history of COVID, so of course nothing. I think all of us are like, have had, the COVID in one or other way. So we all are immune now. Okay. So if it is like, very acute IgM positive, so of course in that case you have to do the isolation. You have to, if the patient is, for, the list, so you have to do all protection. You have to protect yourself, your healthcare professional, your staff, and your everybody. Then you have to isolate the woman. So that's it. You have to monitor her, the silent symptoms, especially, the pulse, the blood pressure. Then respiratory rate is important. Okay, because in pregnancy they have seen that, many of the respiratory, the problems were there. But moreover, if it is a mild case, then, it's not going to do anything. Okay. Yeah. It is like general measures. Okay. It is like general measures. There is no hard and fast rule. And for the last 2 years, we have had plenty of RCOG guidelines on COVID as well. Okay. And in the last guideline, it was not, the different than this, what we are discussing at the moment. Okay. So if you guys quickly want to go through, so you guys can open strategy. So there is a, the very small, the paragraph on COVID. So you guys can quickly read it. Okay. So I think it's going to help if you really want to study about that. But, the COVID itself doesn't come as a station in exam, because this is not our domain. Okay. Because if at all, if it is severe COVID, so of course, that's going to be the ICU specialty. Okay. ICU intensivist. So as an OBG, what we have to do is we have to involve everybody, and then we have to give our care. That's it. Okay. Gynae list. Good question. So for the gynae list, again, read question carefully. Okay. And then, speak about the things which are urgent. For example, the risk of bleeding. For example, the things which can take time. So of course that can be done in the end, and the risk of bleeding will be in the beginning. And don't forget to involve senior. That is important. Okay. And one important thing, don't say who list. There is no who list. Okay. WHO checklist. Don't say who list for gynae. And don't forget to involve senior, blood products, and what else? Yeah, if it is Rh negative, and if it is pregnant, so in the end, so the anti-D as well, this is important. For example, the molar pregnancy that comes frequently in exam. Samreen, histopath. Look, sweetheart, we are talking about gynae list. Yeah. So if somebody is for theater tomorrow, so I will be worried about the intraoperative rather than the post-operative stuff. Okay. If you really think that you have time and you can speak about the more, then only you can go about the histopath and the post-op care and all these things. But I'm more concerned with the intraoperative care rather than post-operative. Okay. Because most of the time for the gynae theater list, they ask about the gynae list that okay, so we have 4 cases for tomorrow list, so can you please enumerate the risk involved in each case, and then you are going to tell me the risk, how you are going to mitigate those risks. So this is how the station goes, isn't it? So if it is the theater list, so then just talk about theater list. If it is pre-op round, just talk about pre-op round. In pre-op round for every patient, what exactly you will check, what is going to be your priority, and what you want to be optimized as a case, and whom you are going to liaise with, and whom you are going to give a call in case of emergency. So these are going to be pre-op check. And for example, if it is the post-op round, so of course post-op round is going to be post-op. Again, there is the post-operative and the postpartum. So don't forget to inquire about the presenting complaint. For example, she's the post-op case of the hysterectomy, and today she is here for her or debrief, you can say, or anything. So just first ask about that. How have you been since your operation? Has everything been good lately? And have you had any problems so far? Any problem with your water work or bowel work? Okay. So this way, start with this, and then go and ask about that. What are her major concerns? Likewise, for every the condition there is, every operation. Okay. If it is postpartum, so talk about how are you doing at the moment. Okay, so how about your the lochia? Is there any heavy bleeding? Any history of fever? Are you breastfeeding your baby? Did you name your baby? Okay, so like this. Okay, be normal, and then talk about if it is any kind of postpartum debrief or postpartum any kind of complication. Yes, who is there? Any question? In a post-op hysterectomy, patient is suspected pulmonary embolism and post-op presidential must be on thromboprophylaxis. So involve thrombophilia expert. Okay, involve hematologist, not thrombophilia. Involve hematologist, involve consultant, and then benefit versus risk outweigh. If she's not bleeding, and if there is the risk of major hemorrhage, you can give low molecular weight heparin. Okay. Yes, acute event of pulmonary embolism, you have to give therapeutic dose until unless she has any kind of contraindication for that. Okay, and if somebody is on the therapeutic dose, so generally speaking, the treatment duration should be mentioned as well, 3 months more or less. Yeah. Okay, or if you don't remember the duration, so go and consult with the your consultant. Can you please recap? I'm sorry, this is going to be cumbersome because I don't have my notes with me, because if you could have asked me, I could have given it, because I really don't want to the mislead at the moment, because that is an important chapter. Okay, so I think bridging thromboprophylaxis, everybody has those charts, so if not, I will send in part 3 guide group, so you guys can quickly go through. Okay, because that is important, and because if I will do any mistake, so that's not going to be good. Yeah, sure, Samreen, I will share. Okay. Yeah, exam tips. Okay. Yes, Atya, of course you will switch to the therapeutic. First of all, you will involve consultant, and then you will go ahead with that. So you don't have to do anything after involving the consultant, and then only you can talk about this. All right, so I was on which part? Post-operative we have done. Okay, and let's talk about the teaching module now. Okay, in teaching module these days things are coming so easy. Even in February exam there was the very good station, the breach, the model was there, the breach, the candidate, the junior trainee wanted to know about the the how to conduct breach delivery. Okay, so don't assume that in real exam, the online exam, you're not going to get such the vivas. Okay, such teaching station. So quickly go through the process of normal labor, breech delivery, twins, and ECV procedure as well. So almost all these things are written in basic practical skills by RCOG. So go through them, and plus we do have Vimeo channel by RCOG. So there are the videos on these stations as well. So I mean 5 minutes with videos. So hardly it will take 30 minutes to quickly go through all those videos. So you can go through them. Okay. So a teaching station is very much, no, nobody is going to ask you to teach odd ratio. Remember, the statistics question never comes in exam. There is definitely going to be some hidden agenda. You have to explore. There can be element of domestic abuse. There can be element of, any abuse. There can be element of bullying, undermining. There can be element of, something, which is bothering her, him or her, whatever. So explore. I mean, if you will ask me that, how you are going to teach me odd ratio, so I'm sorry, I have never done statistics in my life from part 1 to part 3. So, that's going to be hard for me to, teach odd ratio. And on the other hand, the all components of statistics. So I think that's going to be a little bit hard to teach in real exam. Okay. Yeah. So, in teaching, explore bullying, undermining, and then, talk again, talk about agenda, what exactly he or she wants to learn. Does he want to learn only pre-operative things, for example, for anything? For example, if it is breach, so he wants to learn about all maneuvers of the breach. For example, if it is shoulder dystocia, so he or she wants to learn about all steps of shoulder dystocia or just, the initial steps. So inquire about that. Okay, inquire about that, and then go further. CTG is important. Yeah, I know, Salma. It always comes like this. Okay, odd ratio plus the same. In my time there was another question. There was forest plot in 2018. Forest plot was the hype at that time. So who is going to teach forest plot? Come on. I mean, that's very unlikely that somebody can teach forest plot. For me, I only know forest as a forest, not the plot. Okay, so I mean that's very unlikely that if somebody is going to ask you that how you are going to teach forest plot to somebody. So it is very unlikely. Okay, so always explore underlying the agenda or the hidden agenda, and then talk and talk about that. Yeah, teaching severe preeclampsia is important. Teaching yeah, Samreen, I agree. Even in my when we were studying in back in 2018, so the agenda was same. The question was that the junior trainee really wants to learn about forest plot, and the hidden agenda was that she was being bullied, and there was an element of undermining as well. So yes, this way or that way, you have to explore. So yeah, so yes, go through all these things, go through all these things, and in these 3 days limit yourself for 5 days, whatever days you have left. So many candidates will have 5 days, many candidates will have 10 days, because I mean mostly candidates will have exam on 17th. So if it is 17th, then yes, so the people who are going for 17th exam, so remember you have plenty of time, so utilize this time very wisely. And again I will say, don't run after that what were the questions today, what were the questions, what is going to be the question from that center, from that center, from that center. Don't unnecessarily wait, just focus. Okay, focus on yourself, because this is your exam. And perhaps if at all they are going to repeat the exams, they're not going to be the same questions. Okay, they might change some agenda, they might change some the tiny parts. So what happens is that by the chance everybody is so familiar with the station that okay, let me give you example. For example, for me, if I'm teaching someone, and if he or she knows already about the station, they start speaking on the same lines. Okay, that they know from here and there, and they have practiced so far. So listen to the examiner carefully, listen to the role player carefully. There can be any change. Okay, because certainly the questions will not come as such. There can be any change. Okay, so be extremely careful. Don't just start on yourself that yes, I know that this is the station. I have done with this the doctor, or I have done with Dr. Zaib, I have done with Dr. XYZ. So no, listen to the examiner carefully, listen to the role player carefully. Okay, and please be a good attentive listener. Until unless you are not going to listen, trust me, you're not going to perform well. By this time, I understand is almost every candidate who is preparing for this exam is well prepared. Okay, So, you don't have to be like, feeling yourself, giving yourself a feeling that, you can't, go for this exam, you're not well prepared, because this is, the every candidate's, a kind of, what I can say, the psyche that, because curriculum is so vast. And sometimes, it is very difficult for us to, cover everything. All you have to do is that you have to get the essence of every module. If you know how to start maternal medicine module, if you know how to start post-operative module, if you know how to start teaching module, so I think this way at least you can cover, some of the points, maybe not all, but some of the points you can cover, you can gain. Okay. So be very, when you are in counseling station, be very smooth, be very gentle. Don't ask, unnecessary questions. And if she or he starts crying, give him or her time. They are not going to take, a lot of time, because they also know that this is exam. In 10 minutes time, they will hardly take few seconds. Okay. 10 seconds, 20, 30, that's it. All you have to do is that you have to show your sympathy. Okay. And that's it. This is all you have to do. And I think more or less this is all we do in real life as well, isn't it? We do support our patients, we do, talk to them. Sometimes we do cry, as well. Sometimes, we have tears in our eyes as well, but maybe we don't show in front of our patients. Likewise in exam as well. Okay. Because they are professional trained role player actors and actresses. Okay. So they are going to be very, good in their acting. So you may be facing, the very crying lady. You may be facing that, one moment she is crying and the other moment she is normal. So, don't be upset about that. They are actors. This is their job. And this way, RCOG really wants you to, judge in a way that, you can deal with every situation there is. And yes, one more thing. If there is any history of, in sexual and reproductive health module, if you are asking about, the multiple sex partners, and if she is having, if she is commercial sex worker or he is commercial sex worker, so don't bring any, the expressions on your face. Oof, okay, no, it should be very blank. Okay, so this is her job. Okay, so if she is commercial sex worker, so you can simply say, okay, I see. And apart from that, please don't mind me asking that, do you know that, do you know about, the sex partners in the last 6 months? So if she is a commercial sex worker, so this is very unlikely that she will have, the complete record, or maybe she'll be having the record. So yes, in terms of sexually shared infection, we have to, trace the 6 months, the partner. So, don't show any kind of, the unnecessary emotions from your face. And if you think that they are in same sex relationship, multiple sex partners, and if there is any transgender, if it is trans men, so be careful that you are going to call him as him. Okay, you are going to, refer him as him, not her. Okay, because he is trans man at the moment. Okay. So be extremely careful while you are going to, deal with such sensitive stations. So this is going to be my, the sincere advice. And, if you follow, all these things, and I'm sure you all know by now. So this is just like, kind of last moment tips, this is what you can do. And I hope, this is going to help you. So if there is any question, any query, any ambiguity anywhere, so please ask. I'm here. Hmm?
Doctor, Dr. Salah. Hi.
Yeah, Ala, how are you?
Fine. Doctor, is there a difference between trans man and a male partner in same-sex gender?
Same sex is always, the same sex. And in the trans, in the trans men, if it is a trans man, so of course there is a female which is turning into men. Okay.
So maybe, so if two partners who are same-sex, they
yes,
want
yes.
to get pregnant. So shall I ask him who want to get pregnant? Who's the
Yes, yes. No. This way you can ask that, can I ask that, who is going to be the active and who is going to be the passive? who is, you know, the active amongst you and the passive. The one who is going to be active is going to be, you know, the carrying the.
And both of them are still girls.
Yes,
not
yes, yes.
trans.
That happens. That happens. That
Yeah,
happens.
I have friends from Asia. Same.
No problem, no problem. This is very common these days. So, I mean, we don't have to be so astonished for this. So, of course, you know, in that case, you know, we can simply ask that, you know, who is going to carry, have you guys decided that, you know, who is going to carry the baby? Okay. Because, of course, you know, in that case, you have to offer surrogacy because the ovum donation, or not the ovum donation, but yes, you know, the sperm
Donation.
sperm donation. Okay. So, in that case, of course, you have to ask. Yes.
Thank you.
Okay. OSATs, OSATs don't come as OSATs, okay? Again, there is going to be any hidden agenda, okay? Because, you know, if somebody is asking you to sign anything, and because it is naturally, you know, that's going to be the formative OSAT, because at this level, we are not, you know, bound to do the summative OSAT, right? So if it is formative OSAT, then, you know, you have to be very careful, okay? You have to be very careful. Trans men, we can't ask about periods. Look, again, you know, you have to be very gentle and sensitive because, you know, first of all, you have to inquire, you know, that, you know, how long is in journey to become trans man. Because generally speaking, according to the TOG article, it takes 3 to 4 years to have the gender reassignment surgery. Before that, you know, they will have the testosterone hormones, and then, you know, at all, they will be having, you know, the gender reassignment surgery. Okay, so if they are on testosterone, so yes, you know, there is not going to be, you know, the periods cycle, monthly bleed. Okay, but they can have irregular bleeding, they can have irregular spotting until unless they had, you know, the surgery. Okay, so you have to be very careful when you are going to ask about that. So always, you know, judge what is the question, and, you know, the how sensitive you can be and how you can, you know, the ask question. Okay, so in my opinion, first you will ask about that, are you on any medications, are you on any hormones at the moment? So if it is trans men, so of course, you know, he will be on hormones, testosterone, because after, like, I mean, few years of testosterone, then only they can have gender reassignment surgery. Okay, Salma? Thank you so much. Thank you so much. So is there any question, anything I can be of help, so please ask. No question? So it means all of you guys are ready for exam, and inshallah, it's going to be good. Okay, all you have to do is that, you know, stay focused, just revise your own stuff in these days. Okay, and limit yourself, limit your activity. Don't go here and there. Don't ask, you know, many people that, you know, how are you preparing, you know, how's your preparation. Again, I will say the same, you know, we can't compare our journey with anyone's journey, right? So we have to be very, you know, gentle on ourselves and on others as well. Okay, so of course, Salma, you are in my prayers. You are in my prayers. Okay, what to do in the last 2 days? In the last 2 days, again, I will say relax, and if at all you have to revise yourself, don't practice stations. Okay, I will advise that don't practice stations, too many stations, in fact. Okay, and with, you know, your study buddy or with yourself again, because this way, you know, sometimes this is a human psychology, that, you know, if you will miss anything, so you will be, you know, kind of a little bit upset that, you know, that, oh, these are my last 2 days, and, you know, I don't know this thing. Okay, so limit yourself, revise your own stuff, don't go here and there, just, and please take good sleep before exam. Don't be up overnight. Okay, don't go empty stomach in exam. This is another advice. And yes, check your internet connection, check your extra batteries if you are in countries like us. Okay, so you have to be very careful, because, you know, if there is any electricity problem, so this is our problem, this is not RCOG problem. Okay, if there is any network problem, so this is our problem. So we have to be very, you know, the good in all these things. So keep an extra connection, keep, you know, the batteries with you, So there should be, the extra electricity, the things as well with you. Okay. So in these 2 days, I think, work on all these things rather than, exploring new things, exploring new stations, performing new stations, asking about new things. So don't do that. Okay. For the last 2 days, if you have your exam day after tomorrow, yeah, right. So, and before that, if you guys have, enough time, like 5 days, 6 days, 7 days, then yes, you can, do some kind of practice. You can revise your own stuff. Okay. Revise your own points. And that's it. Again, I will repeat the same. So I don't want to sound repetitive, but again, I will say be yourself. Okay. Be yourself in exam. You yourself are unique. And I'm sure, you can show your capability and, the good knowledge in exam. All right. Yes, always there, always there. Okay. And on the other hand, I'm here. If you guys need any kind of help, you guys can send in your queries. Okay. But not the long stations. But if you guys have any query anywhere, post in the group, and I'm easily accessible. So you can, reach out to me as well. So yes, again, we'll say the same. Stay focused. Okay. And yes, the dress code. Somebody has just texted me for dress code. For the girls, it should be like, very, the nice color shirt. Okay. It can be the collar one, or it can be, anything you are comfortable with. The scarf, if you want to, have, so it should be like, very good for you, that, it shouldn't be very tight. So, you can't hear anything. And I'm sure you all have had the overhead phones. Okay. So it should be, overhead phones, so it will be very easy for all of you. Plus, what else for the boys? Again, it should be the light color shirt, and you should be wearing tie. It looks very, the formal look. And yes, even if it is online, so yes, this way or that way, we are in exam. Okay. Likewise, we can't go in, the boxers, we can't go in, the t-shirt in exam. So likewise, in real exam, face to face. So why over here? For the girls, again, I will say that, don't wear too much of jewelry. Yeah, of course, don't wear, too much of jewelry, too much of makeup. And if you want to wear, the lip shade, it should be very, the simple. Okay, the simple, the light color. And there shouldn't be one, because I have seen many candidates for, because I teach online as well. I see, many candidates scratch their heads, scratch their beards. Okay. And they do, things, and, they don't do that. Okay. This look little bit, the kind of, not good. Okay. For exam. For the girls, you shouldn't be scratching, you shouldn't be doing, in your heads, and you shouldn't be, if at all, if it is scarf. Okay. So it should be like, light, and it should be, very good, that at least you can hear. So this way, you are going to be comfortable as well. All right. And the colors should be very, the light, ideally the blue, black, and for that considered to be the, the formal colors, isn't it? So we are comfortable, be comfortable. This is online exam. So, you all have to be like, very natural, and you have to look good. In fact, okay, you have to look good. It's not like that, you have to, behave like an actor or as an actresses. Indian wear is okay, sweetheart. Indian, Pakistani, Bangladesh, we all are same, right? Our wear is same. So no, lipstick you can wear. Okay, it's not like that you can't wear lipstick, but it shouldn't be red, and it shouldn't be bright, purple. It shouldn't be bright, the kind of orange, and it should be like, the natural shade, pink, I must say. Okay. Indian wear, if you want to wear, yes, you can wear the nice kurta. Okay, kurta should be, the very good. If you want to take dupatta, so it should be like, very easy on you. Okay. So it's not, there is no hard and fast rule, again, I will say. But I have seen candidate, they were with, the long, the jhumkas, and, the gold jhumkas, and, the long, what you say that, the things, it shouldn't be there. Okay, it shouldn't be there. So you have to look, very easy, decent attire. It should be easy, because exam is stressful. It's not like all the time you are, checking your neckline. You all the time you are checking your, the collar. All the time you are setting your dupatta and everything. You have to be comfortable. Okay, you have to be comfortable. So attire should be like, it's all up to you, but again, it should be very decent, it should be very easy, and you have to be comfortable. Because at all time, if you are, doing the things, and to make yourself comfortable, So this way, you know, it will not look, you know, so good. It will look, you know, something, you know, that you are not familiar with. Okay. Lipstick you can wear, Salma. Okay. But it should be light shade, not that bright. And Indian wear is absolutely okay if it is kurta. It looks very good. But if it is collar, it looks more good. Let me tell you, because that looks more, you know, the good professional look. So, Dr. Hassan, how are you? Hi.
Hi, Dr. Zaib. How are you?
Hi. I'm good, Alhamdulillah. How are you?
Alhamdulillah, I'm fine. Thank you so much.
Thank you so
I'm sorry
much.
for being late to join this very brilliant session. I know that you are brilliant, so the session will be almost brilliant by your attendance. So,
Thank you.
yes,
Thank you. We've been
thank you
waiting
so
for
much.
you.
And I wishing the best of luck to all candidates who will appear in the May exam. I just joined when you are talking about the dressing, how should you dress in the exam.
Yes, yes.
So I think you mentioned everything. My point of view is you have to wear something comfortable completely, because the setting is very difficult, and the stress as well is very difficult. Smart dressing is critically important to you should wear something not markedly affecting the examiner's eye. Okay, so I suggest that the very bright colors should not be used, like a yellow color, for example. Yellow is very hot color, so the examiner's eyes will be you know, the examiners are suffering a lot in this exam, because you know that very well, we are sitting for the 2 circuits over the day. So the candidates are moving in one circuit, and then they will go away from the exam. So the examiner will wait up to 28 candidates to finish them. So I think he will be tired, and we would not like to make him much stressful. So I think that blue color is great. Green is very good as well. Get away from the hot colors like orange, like red, like yellow. These colors are really annoying. Maybe that's from my point of view. Okay. Overall, I don't know what you are talking about, but my advice is, rather than being careful about the smart looking, I think you need to be more thinking about smart actions in the exam. This is the core. And again, I have to repeat this. All of you are knowledgeable, okay? Maybe knowledgeable more than me and Dr. Zaib. Maybe more knowledgeable than the examiner in front of you. But the game is not about the knowledge. Don't try to say everything. Don't try to talk too much. Once you are talking too much, you may be able to do more mistakes. While if you smartly asking questions and just listening to the role player carefully and explore her agenda, not your agenda. This is the core of the exam, okay? Don't follow your delusions, okay?
Yes.
Yeah, for example, a situation that should be managed ideally by surgical intervention. There are some medical options, but surgery is the best. The patient is telling you that I would like to avoid surgery. So don't spend the whole station discussing the surgical options because they are right. Don't do that. You can simply discuss the non-surgical according to her wishes, and then just give a hint that surgical intervention at some point may be needed after evaluation of your condition and after consultation with my consultant and so on. So don't spend the whole station discussing your concern, not her concern. This is extremely important. Exactly, Samreen, this is what I mean. A patient with SUI, she would like to avoid surgery. Don't spend the whole station discussing Birch, TVT, what are the possible, there is a bulking injection. It's not like this. Okay, lifestyle modification, weight loss, smoking avoidance, correct the chest diseases, pelvic floor muscle exercise with physiotherapist, duloxetine may be used. If all these methods unable to improve your condition, then I'm afraid that it could be maybe we are in need to have a surgery. However, it's very early to think about this, and I will need to evaluate you after 3 months with my consultant to see the improvement. That's it. Don't get too much in deep knowledge in simulated patient task. Because I noticed this, Dr. Zaib, actually, I noticed this. People are always trying to open a door, which is very difficult to be closed.
Exactly.
Okay? Exactly. So if the patient, for example, or she's asking you about a syndrome, for example, whatever this Alport syndrome, Mickel-Gerber syndrome with the baby. Don't say it for her. Your baby scan shows Mickel-Gerber syndrome. Do you have any idea about this? Of course, she has no idea. Some doctors has no idea about Mickel-Gerber syndrome. So a normal person, of course, she has no idea. So there is no need to act like this. There is no need. Don't say the syndrome. Don't say the disease name. You are simply can explain it in a very simple lay language directly. For example, a patient with SUI, like Samreen example. A patient with SUI, don't say, yeah, your situation is most probably a stress urinary incontinence. Do you have any idea about stress incontinence? She will say, no, what is stress incontinence? Aha, there is a problem between in the, you know, the bladder and the tube connecting bladder from it to outside, the, you know, a water pipe, and there is a descent due to, what are you doing? It's too much time wasting and effort wasting. All the game is, I think you have a problem with incontinence problem, which is mainly related to your muscles in your pelvic floor. It somehow shows some weakness, and we need to strengthen this muscle to correct your problem. That's it. Very simple way, okay? You will save a lot if you do the same. And the second advice, I think, Dr. Zaid, it's a common pitfall. People are in information gathering. People are trying to ask about everything.
Sir, I was just, you know, mentioning you while I was addressing this thing, that, you know, I remember you saying last time that 70-year-old lady, she's here with overactive bladder, and I'm concerned with, you know, pardon me asking about, you know, the recreational
You are
drugs.
asking about recreational drugs in a patient
So
with
then-
70 years old, okay? If she is drug addict, she may die from a lot of time, okay? So it's
Exactly.
a completely irrelevant question, irrelevant, okay? So don't try to fulfill the whole history in all cases. It's not like this, okay? Try to choose the most relevant questions, maybe. Maybe you may miss one question relevant, okay, if you tried this. But I think it will not affect your whole mark and your whole performance. But on the other hand, if you spend 5 minutes or 6 minutes taking history to fulfill all points, I think it will markedly affect your global view, because you have no time to discuss investigations, possible examination points, and discuss the principles of management. So definitely the whole mark will be affected, okay? And the last thing I would like to assure all of you, it is not like all or none. What does that mean? It means that if you did so bad in the station, it doesn't mean that you fail in this station. Never. It's not like this. You may fail in one domain, getting past in another domain. So try to do your best, okay? And don't be anxious. Try to be calm. Try to be confident, okay? And don't think about passing or failing, because nobody knows. Nobody knows. We are looking for certain points. You may do very good in the station, but you missed one point, which I should mark you as fail in this domain because this missed point. Nobody knows. And on the other hand, you may do many mistakes, but you mentioned this point. I will give you pause. Okay? So don't think like, am I past this station or not? Maybe yes, maybe no. Nobody knows. Once you finish the station, forget everything about the station and looking forward the further one. Okay? What do you think, Dr. Zaib, about this?
Yeah, exactly. I will second you for this, because in every station, it's not like that, we have to fulfill the complete package of the guideline. But of course, we do have, the few things, like somebody is asking that if we missed 1 or 2 points in patient safety out of 5. So I'm afraid, in every station, they're not going to be, the 5 safety points. Rather, in every station, almost there is 1 or 2 safety checks, which is very much important to, fulfill. Like, for example, if it is OHSS case, if you are giving, the dextrose along with thiamine, so it means you are breaching the safety. Sorry, not the OHSS, it is nausea vomiting. So in OHSS, if you are giving NSAID, so it means, you are breaching the patient safety. You're not a good doctor. So at least, these type of major safety checks, these all should be in your mind at all times. Okay. So this is very much important.
And one of the most important things, let me ask all of you. Most of stations, 99% of stations are repeated stations. And all of you know these stations before getting inside the exam. So why people pass and other fail? Why? Yeah. You have to ask yourself this question. It's related to the approach. How can you present yourself, present your knowledge? And in the same time, you have to think about what are the important things I have to say rather than the regular informations. If I asked you about, I will give you a very simple example. If I asked you about shoulder dystocia, now if I asked a student in the medical college about shoulder dystocia, he knows the answer. He knows MacRoberts, he knows internal maneuver, shoulder, posterior arm delivery, and so on. So if you spend a lot of time saying these points, I think you will gain nothing. Because 100% of candidates will say the same thing. But smart candidates will remember, ask patient to discourage pushing.
Yeah.
Bring the patient in the ideal position to the edge of the bed.
Edge of the bed.
Discuss
Stop
with him stop oxytocin.
Stop syntocin.
Cord blood sampling post-delivery. Okay. You will be really evaluated regarding these tricks, not regarding the regular information. This will make a difference rather than the others. So you should think in that way, not in this simple haphazard way. Okay, this is my advices, and I wish all the best to all of you. All of you are dear friends. I can see the names here and there, and all of you, I think you followed us for a long time in mid-exam, Dr. Zaib, Dr. Bradnia, Dr. Bouja, and me as well. So I think all of you have these concepts in your minds. What we need to do is to activate these concepts. Don't forget it. Don't make the stress and anxiousness affecting your performance. Because overall, it's a game. It's just a game. It may take time. It may be money consuming, but overall, at the end, you will be a member of the Royal College later or soon.
Today or tomorrow.
Yeah, maybe after a few hours, you will be a member of the Royal College. So it's a matter of time, how to be patient and how to be confident. Okay, this is the game. This is the game. Dr. Zaib, the mic is with you.
Yeah, thank you so much. So this is what I was telling, that more or less, if the stations are repeated, so the differences are going to be that how you are going to approach the exam. Like the other day I was with one of the exam candidate in my mock station, the exam. So she was in a hurry to just like tell me that yes I know about this station. So what I did was that I changed the station a little bit. So she got confused in the middle of the station. So she was telling that, oh, I didn't know that, this is not that station. Okay, so again, I will say the same. The question may be familiar to you, the topic may be familiar to you, but listen to the role player, listen to the examiner, because there can be something, that changed, which can change the whole scenario. Okay, so don't fix your thought process, don't fix your mind in that thing that you just have to tell, whatever you have learned so far, whatever you have practiced so far, whatever you know from, the templates here and there. Okay, again, don't fix your mind on the templates. Okay, again, there is a trend these days that everybody is after template. Okay, this template, this template, this template. Templates are helpful, but it's not going to give me the 100% passing marks in exam. I will pass my exam with the best of my knowledge, the performance, how I do in the exam in front of examiner and the role player. So I will only pass with that. So
You
don't
know,
take,
Dr.
yeah.
Zaib, according to this point, in the last exam, the exam brief, okay, for examiners, they are commenting that all
Everybody is,
candidates,
yeah,
all candidates
everybody
are,
is talking.
they are copy paste.
Copy paste,
Copy
exactly.
paste. They are asking questions in information gathering in the same sequence.
Yeah.
One of the candidates asked about contraception history in postmenopausal woman.
Oh my
I
God.
swear, أقسم بال يعني I don't know, but I swear he asked about contraception in postmenopausal patient. So this is showing us how much following templates, like what you said exactly,
Exactly.
is the
Exactly.
disease. It's a disease.
Yeah, for me
of
it's
the
a syndrome,
candidate.
sir. For
It's
me
a
it's a
syndrome.
syndrome.
Yeah, don't do
It's a
that.
group of collective disorders.
We can depend on the schemes and templates a little bit on difficult
But
long
you cannot
stations,
follow all these
like
lines.
difficult long stations like labor word prioritization or gynae operative list, antenatal high risk. Sometimes you may need to fix some important information, but it's really important to show the examiner your effectiveness to choose the relevant questions, the risky points, and to be smart enough to show this point. Now, regarding when to say about examination, we have two schools about this, Cherish, actually. The first school said we are in online examination and no need to mention examination. Okay. The second one, which I'm from, is to say you can mention examination rapidly in between the discussion, just to show the examiner two important things. Number one, your systematic approach thinking in evaluation. Number two, sometimes, I don't know, sometimes maybe hidden information may be provided for you at some point. How can you do that? If you are discussing with a patient a certain situation after taking the history, thank you so much for sharing information. I would like just to examine you in presence of chaplain. However, before that, I would like to offer some investigations or tests. And then you just mentioned examination rapidly. Now, I'm always saying this. When the exam was live, okay, live exam, did we used to offer examination or not? Sometimes
Hardly ever.
yes,
Hardly ever.
sometimes yes, sometimes yes, sometimes no, according to the scenario. So even in live examination may be offered, maybe not. So if you offer that in the live exam, anybody of us, did we do examination to the role player in front of us? Never to touch her. So we are pretending, we are in play. So you have to act like, okay? You have to act like. The aim is not the examination itself. The aim is to show the examiner how much you are systematic approach thinking, okay? If you can do this mission, do it. Just do it. If the situation requires examination, do it. Offer examination. If it doesn't need examination, then bypass the examination step.
Yeah. That's what I was
Exactly.
telling these guys, like, I mean, that if at all if it is needed for your management, then of course you are going to examine, you are going to offer examination, but otherwise, no need to unnecessarily say. And then, again, you will be like, I mean, little, again, very concise in this thing. I would like to examine you. Then don't, emphasize on that blood pressure. I will call midwife, she will take blood pressure, pulse, temperature. I will take your, the
Exactly.
tummy examination. I will do speculum examination. I will do pervaginal examination. So, I mean, we can't do that. We can't do that.
I have a very, very important thing to say is
Yeah, please.
try to act, but don't be overacting. Okay. Yes. Try to
Yeah.
act, but don't be
Don't
overacting.
overact.
Try to show empathy, but don't cry with the patient. Okay. This is very important because some people are so much overacting, like what you said exactly. I would like to just examine you for blood pressure, pulse, temperature, and I ask the midwife to or the nurse to take the what? This is too much. This is too much. And now in some stations in the exam, you will find that in the instructions they can tell you that examination is not
Examination is
needed.
not necessary. Is
Not
not needed.
necessarily, exactly.
Yeah.
So it will be helpful. Yes, exactly. It
So
will be
that's why,
helpful.
it is said that read question carefully because many information will be given outside. So what we do is that I know this is a case of male factor infertility. Oh yes, this is the steroid. Okay, go inside, and inside, there is no role of the steroid, but this is, the male factor infertility. So
This
I
is
mean,
what
you have to be very careful.
this is what I meant by don't follow your delusions.
Exactly.
Okay, this is
Exactly.
your delusions. Now, the same station, if I changed the PMI, just a number, if I changed the patient's age, the whole scenario will be
Whole scenario
completely
will
different.
change.
Now, if I gave you a history of a teenager girl with she is immigrant and she is living with her friends, for example, and she has any medical problem in pregnancy, I need to think about certain points because she is at high risk group. She is teenager, she is immigrant, she's living with friends. So I should think about addiction, I should think about abuse and many other things. While if the same disease with same scenario, but the patient is 38 with 3 children before and coming to the clinic with her husband, okay, I will put these points in my mind, but I will never stress on these points
Yeah.
because the patient is not in the high risk group. So don't miss these tiny points because it makes a big difference in your thinking way and your performance. This is very important.
Exactly. So I will second Dr. Hassan for this. And I hope, that many things are clear by now. If still there is any query, please do ask. You guys can open your mic and you guys can, ask directly. Okay.
Assalamu alaikum, Dr. Zaib and Dr. Hassan. Javeria
Walaikum
Sumra
salam.
here.
Hi, Javeria. How are you?
I'm good, alhamdulillah. I just wanted to ask you now in Oslo webinar, there's some, the person who was conducting the webinar, there was in ambiguity whether she was very confused whether it should we say about examination part or not. So how should we cover this part? Like we should be listening. First of all, I had this thing that whenever we would get the briefing done in the from before the exam, so we will just focus that time or we will ask about their school of thought that about we should say about examination part or not. Otherwise we could have been said that if the examination is very necessary, we could have said the patient that since this is an online consultation, but we would really like to have your examination done at some point. Do we is it appropriate to cover this part or not?
Generally speaking, when it was face-to-face exam, back in 2018, when we passed our exam. So, even in that time, the examination was not, the mandatory because in 10 minutes time, generally, when we have long case, in our countries, so of course we do have 25-30 minutes, 10 minutes for history, 10 minutes for examination, then 5 minutes for conclusion, and then you are going to present, isn't it? So that is the part for the long case. But I'm afraid for the OSCE stations, if at all you need some kind of examination, like I said earlier, that for example, if it is infertility station, for example, if it is OHSS station, for example, it is nausea vomiting station, for example, if it is a, the station in which I need examination findings, for example, I do need to admit her to the ICU, ITU, I do need to, send her to the another specialty. So yes, in that case, I will say that, I would like to go through, but I would like to, examine you, I would like to send some investigation. So perhaps in that case, examiner will show you the examination findings and, the examiner, the labs as well. Okay. So I don't think when it was face-to-face exam, nobody did examination. I'm sorry, this is my, the thinking, and I'm very firm in this because, I failed this exam, I passed this exam. So far, I have never felt anything that, oh yes, I have to do examination in the presence of chaperone for, the contraception cleaning, for until unless, she is here for IUCD fitting, then yes, I need, the examination. But if she is here for IUCD consultation, that just ask about the methods of contraception, then yes, I don't need anything at the moment. But if she is here for that because my colleague has asked her to come for IUCD fitting, so yes, in that case, I do need to examine her, I do need to take a swab, I do need to give her a prophylactic antibiotic, and then, I'm going to do the IUCD fitting. Okay, so don't fix your mind in this thing that, you have to fix your, the complete focus on this examination thing. So I think you can quickly, go through and you can quickly, pass this examination thing as well. Okay, for me, I have never done, so I don't know, if you are comfortable to do, you can do it. I have never done in face to face, so how can, I can tell that, it's appropriate for video consultation? I don't think so.
So basically, you mean to say that we have to analyze according to the situation, whatever the situation is going to be.
Of course. This is preconception counseling. She is known case of epilepsy for last 10, since childhood. And, today you want to do the examination. Why? Do you think in preconception counseling in epilepsy, you need her to lie down and, you need to do the per-abdominal exam, the per-vaginal exam and everything? I think it is unnecessary.
Yes, obviously not.
It is unnecessary. Okay.
Hello, ma'am.
Okay. Yeah, Tanya.
Ma'am, then quickly we can say that, like in case of preeclampsia, we can say that in presence of chaperone, I would like to check your blood pressure, urinary protein, and also I would like to run some tests, like how your
Preeclampsia
kidney
is important. Now you are justifying yourself because we know the preeclampsia management will start from the history examination, isn't it? So it will start from examination. Blood pressure.
So quickly, I just I want to cover.
Yes, you want to cover, but it will be according to the station. All right. So if it is preeclampsia, so we know that preeclampsia management will start from blood pressure. So I do need blood pressure. I do need protein. Then I need to grade whether it is mild, because these days, according to the new guideline, there is only, the hypertension and then severe hypertension. Okay. Likewise in eclampsia, again, severe eclampsia and eclampsia. Okay. So once it is preeclampsia, so of course, we have to manage accordingly. So, I mean, manage according to the case to case. In preconception, it's a very cold case. So no need to do blood pressure, no need to do examination. Why? But if it is preterm labor, so yes, I do need her, the recent findings. I do need, is she contracting at the moment? I want to know that, how far is she in her labor? Has anybody done an speculum exam? Okay. So is there any, the history of the rupture of membranes or no? So that is important. So for example, this has been one station in RCOG back in 2017 and 2018 as well, preterm labor. So, when we have said that yes, I may need to do, then examiner gave us findings. So yes, okay, so she had, the amount of like this and, the lie of the baby is transverse. So that was, accordingly that, in the preterm birth, so if lie was transverse, so how you are going to manage the labor, and it was structured discussion task. Okay. So it all depends upon, when and how you need examination. So please, for me, I would never unnecessarily offer anybody any examination whatsoever. Okay. I hope this examination part is clear now. All right. Any other question? Okay, Tanya, thank you so much. Thank you so much, Salma, Samreen, everyone. Okay. So I would conclude my session here. I won't take too long because otherwise, we all will be talking and discussing. I would leave you guys for your preparation. Okay. Go back to your preparation. Okay. Don't again repeat. I will repeat few things. Okay. Don't unnecessarily do practice these days. Okay. Don't go here and there, sneak peek here and there. Okay, what's happening in that group? What's happening in that group? What's that girl doing? What's okay? No, this is not our job at the moment. Okay, so focus for your own preparation, revise your own stuff, revise your own points. Take help, if you really want to take from somebody, if you really trust somebody, because this is the high time. You need a very sincere and a genuine help rather than so many random the helps here and there. All right. So just stay focused and you're almost there. Okay. So far,
Dr.
you are
Zaib, one question I would like to ask.
Yes.
Dr. Zaib, as you discussed about forest plot or something unusual station from this module, biostats, something like that. So in the previous RCG mock, we were hearing from people that people were saying it was trainee who was asking to teach this forest plot. Obviously, we don't know much of the biostats.
Nobody knows.
So
I just know forest is jungle. That's it. I don't know more than that.
So that girl has asked to rule out undermining and all this bullying. So
Yes.
the trainee was role player was saying, why you're trying to rule out this thing? There's nothing such thing. You just teach me forest plot. So how to tackle that thing, that
So
station?
you
if
can
it
simply
won't,
say, you can simply say that I'm sorry, at the moment I don't really know that how to teach forest plot, but this is the part of the our teaching. So I will get back to you once I am very good in teaching this thing. Okay. So far, if there is anything I can help you with, so I would really help you with that. And forest plot, I don't think that forest plot will come as ever as a station. Okay, this is I mean,
no, it is.
I'm
It was
99.9% that this is
RCOG
unlikely.
mock. It was a RCOG mock, and people were taking like hidden agenda for the bullying. But again, the role play was saying like that. So
So
that's why
it's not always bullying, sweetheart. So there can be domestic abuse, there can be any sexual abuse, there can be any the element, any of the element. Okay, there can be any of the element, anything. So explore. So it's not always undermining and bullying. There can be many things. Because I remember there was one station in RCOG mock as well, in which the girl has had a boyfriend, who was very abusive, and she was very, distressed because of that she cannot concentrate on her studies, on her work performance as well. So that's why she was here. That she just really want to finish her the OSATs, and she just wanted to get them signed, and then she wanted to switch the hospital and the place as well. Okay. So it happens. So you have to explore
okay.
and
I got the
explore
gist, not just undermining from the
no.
colleagues,
Of
but it
course
could
not.
be anything. Okay.
Anything which is affecting mental health. Okay, anything which is affecting mental health, and it can be anything whatsoever. All right.
Okay. Thank you so much. Got it.
Okay. Welcome. So all the best, everyone. So I will leave you guys for your preparation. Okay. Go, with the full confidence that you can do it, and just revise in the last, all these days, and just stay focused. Okay. Be yourself. Again, I will say the same. Be yourself. Okay. And be natural. Be yourself, and stay confident. Start your session with the full confidence, and read question carefully. Don't overlook, and don't be over smart that okay, yes, I know this is station, this is malfactoring fit, oh, I have done this station, this is reflective practice. So maybe sometimes it cannot be the same station. Okay, so read question carefully. All right, and listen to the real role player as well. This is important because sometimes role players do guide you. All right, so all the very best, everyone. So I will see you some other time. Okay,
Thank you very
some other
much.
thing.
Thank you
Okay.
very much, Dr. Zaib and Dr.
Salma,
Zafar.
you have my all the best wishes. Okay, you have my all prayers. Okay, you are so dear to me. You know that. Okay, so all
Thank
the
you
very best, sweetheart. I will definitely pray for you.
very much.
Okay. Bye bye, everyone. Good night.